Hello everyone. Welcome to season 2 of the Dialexicon podcast, a channel targeted to the youth where we critically engage with leading scholars and connect philosophy to contemporary social issues, all at a digestible level. My name is Rohan Goyal, and this week we are joined by Dr. Dias Duran. She is a philosopher specializing in bioethics and normative ethics and holds the position of research fellow at the Institute for Ethics in AI at the University of Oxford. She also earned her PhD in philosophy from Ruhr University Bochum in Germany. Hi, doctor. How are you today?
Hi, Haruhan. Hi, how are you?
I'm doing well. So before we get into some of your work, I wanted to talk about a little bit of your background and your experience in academia. So could you explain sort of what has been your experience in the academic field and what has led you to philosophy in general and where you are today?
Of course. My connection with philosophy started when I was in school. I was an avid reader, and I remember starting reading, I think, Nietzsche in something like ninth grade. I was in a Catholic school. This was not ideal for my religious religion professors. But it gave me a sense of what philosophy did, what kind of inquiries made regarding society, regarding what who we are as humans, and what should be doing in politics, in different fields. But I actually formally had connections with philosophy by accident. So I actually applied for a degree in anthropology for my undergrad. And I also got a scholarship to study at a university I really wanted to study, but this university only had a program in philosophy. So I decided to go for this university and study philosophy. So I was not my first choice, but then along the way, the first couple semesters, I fell in love with philosophy, and I decided that this was actually what I wanted to do with my life. And from there, I did my undergrad. I am from Colombia originally. I did my undergrad in Colombia. Then I applied to do a master's degree in applied ethics in Germany, where I did also my PhD at the Ruhr Universität Bochum. And so one aspect of philosophy that I was always really interested in was how to take those concepts, those theories, and bring them to applied contexts to concrete questions in society.
Hmm.
I did my bachelor's thesis about the Colombian conflict and how could we develop a theory of the concept of forgiveness based in a philosophical work. Um, and then I did my master's thesis about the concept of medical futility in palliative care and what does philosophy have to say about that from the perspective of bioethics, biomedical ethics. So I was always interested in these concrete questions and how to connect theoretical philosophical concepts and bring them to them.
I see. And you mentioned you were somewhat interested in other fields, anthropology, and I'm sure others. Could you highlight maybe some aspects of philosophy as a field that you think is particularly interesting or useful when studying like social conflict or social issues? What can philosophy specifically offer that is unique, I guess?
So one of the concepts that I found really useful when doing my undergrad and for my thesis was the exploration of the concept of conflict, the concept um, of memory, and of forgiveness. So forgiveness in itself is not a philosophical concept in the traditional sense, but the anthropology around forgiveness and memory it is definitely a problem in philosophy. So bringing anthropology, bringing politics, because at the end, this was also a political question about how do we go about. So we have this process of transitional justice in this context of the Colombian conflict. We're ending that conflict with the peace process, and how do we move forward, and what does philosophy could inform us about it. So I brought the concepts of the anthropological questions about memory and forgiveness, but also connected with the political questions about justice. So those are, two interesting concepts that philosophy give from different perspectives that were very, very useful for that kind of inquiry.
I see. And I think you've sort of touched on this already, but do you think you could succinctly answer a very broad question about what is philosophy and what is its goal in general.
Well, that's I think everybody who starts studying philosophy has this first question first semester, and um, I always wonder if there is anybody who comes to a clear conclusion.
Of course.
So, well, I mean, I can say that philosophy is a discipline of study, but also is a form or way to look at the world, to study the world, to study reality, to study the phenomenon we are confronted with, that are the questions we are interested in, and it's almost a way of, yeah, of approaching reality. Um, it involves certain um, elements or methodologies and a degree of rigor that is quite important for the philosophical questions that we're interested in. Um, so, and of course, I would say there's like, at least two different ways of thinking about philosophy or doing philosophy. Is doing philosophy in a general sense. Children do philosophy by asking these complicated questions, by imagining or thinking outside of the box to answer those questions. Sort of, who am I? Is it color red? Actually, everybody sees color red as color red instead of color blue. These are questions that touch about metaphysics, they touch about phenomenology. So that's one way of doing philosophy, and lots of people do philosophy without meaning or intending to be philosophical. And lots of disciplines do philosophy or asks philosophical questions without intending to do philosophy in the classical sense.
Sure.
And on the other side, we have the philosophy as a profession, and people who dedicate our lives to philosophy do philosophy in a more systematic way, so to speak. So we refer to the sources, we read the philosophers, and then we bring those or try to expand from those theories of that work and bring our own perspectives to bring into the questions we're asking at the moment. And in that way, the systematization of philosophy is what maybe distinguishes doing philosophy as a common practice and doing philosophy in a professional way.
I see. Yeah. And in that sense, um, you mentioned this as well, but the rigor and the sort of uh, intellectual weight that is given to this organization is very important, I would understand. And it's sort of comparable to fields of science. And it's very interesting to see how that same process of thinking overlaps in a lot of these fields. So now I want to move on a little bit to some of your own work. As I understand it, a lot of your work is centered around medical AI ethics. So if you could just broadly talk about what this field is and what sort of questions does this field try to answer, and we can go from there.
Of course. So to be perfectly precise, I come from a background of bioethics, so medical ethics, which is a philosophical, let's say, subfield. Right now, I'm not working so much in medical ethics as I was doing my PhD in before, but I'm still connected to it in such a way because it's one of my passions. So, well, medical ethics in the philosophical sense asks questions about or connected to the practice of medicine, connected to so questions about the beginning of life, the end of life, what happens in between in terms of our health, our bodies, our minds, that connect with being healthy or not being healthy. And these are deeply practical questions because we need concrete answers to go about certain things, or certain decisions in medical practice. So um, you think about questions about terminations of pregnancy. Those are biomedical questions. You think about organ donation, the ethics of the organ donation, or the ethics of genetic modification, the ethics of implanting chips on people's brains, the ethics of palliative care. Those are all biomedical questions. So you think about things that happen in concrete scenarios that reach the media, that concern lots of people because of questions about our life, our health. And these are very difficult questions. They have high stakes, their consequences are very dire or very critical in terms of life and death,
Hmm.
or illness, and dignity about leading good life. So they are of ethical import, they have a high impact in how we make them, how we phrase them, how we study them, and how we respond to them. So I'm very passionate about this in first because of the practicality of it. So this critical work that needs to be done now about them. It has been done for many years, but also because these are questions that require collaboration among fields. It's not something philosophy can do on its own, but it's also not something medicine can do on its own. So it brings together people to think about these things together and
Mm,
collaborate in them.
definitely. Yeah, and if I understand correctly, you also have done work regarding AI in this field. Um, so could you talk a little bit about what it means for AI to pose ethical implications, and then how, uh, what exactly are the phenomena that you're studying with this intersection of AI as well?
Yes, so I mean, artificial intelligence is, it's an umbrella term.
Hmm.
When I think about artificial intelligence, usually speak about modern machine learning, deep learning, and generative AI.
Sure.
Because before that, there were other types of systems that were applied to medicine, for instance, expert systems, and there were kind of decision-making processes automated that were implemented in certain areas of medicine. So just to clarify, when we think about AI in healthcare, we usually refer to modern types of machine learning and beyond that, like after what
Yeah.
came after that. Um, and why is this important? Well, artificial intelligence it's being marketed and promoted in many areas of human activity as revolution, as bringing these promises about what they could achieve to benefit or to improve the practice of medicine. And one of the chief arguments about these benefits is connected to accuracy. So this is very attractive because if we think about particularly in certain fields like diagnostics or um, um, research into development of pharmaceuticals, there's lots of errors or lots of difficulties about medical mistakes, medical errors being done by humans. It's estimated by the National Academy of Medicine that between 10 and 15% of all diagnostics in general are either inaccurate, incorrect, or delayed.
Mm.
So in these, as mentioned before, this has high stakes consequences. If a diagnosis, for instance, of colon cancer gets delayed too long, it might be impossible to treat it. So this might mean a difficult situation for the person
Of course.
suffering from this type of cancer. Same for pancreatic cancers, things like this. There is a lot of an attractive reason why applying AI in healthcare is, is a good idea, and lots of area of opportunity in which AI could make the practice of medicine better, not just for patients, but also for the systems themselves, for the practitioners. And this, of course, has created a sort of hype around
Mm.
the 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 implementation of the systems. The problem connected to that is that hype usually makes people overestimate the benefits of the technologies. And this is something I am particularly interested in. What I did in doing my PhD was I saw one problem or one issue there that was why is it taking so long for these medical advancements to be actually implemented in medical practice? Because at a time, so when I started my PhD was in 2020, AI, so machine learning was already in the field for, I don't know, say like 5 to 10 years, but we have not seen lots of implementation advancements. It was very delayed. And the question I asked was, why is the case? Why is this the case? And what I found was also different kind of gaps, epistemic gaps, implementation gaps, regulation gaps that made this very complicated. But one of the most important gaps I found was that it was not clear how the benefits and the risks were distributed. So it was not clear in which cases, of course, always about trade-offs,
Mm.
in which cases by implementing certain technologies, we would have to make a trade-off between, well, accuracy and trust or accuracy and fairness, depending on the machine learning system or the model and the concrete scenario. So I was really interested in from the philosophical perspective to understand how these trade-offs come about, how to identify normative questions that arise in these moments where AI is being implemented in the scenarios, and how can we resolve them. So that's what I did in my PhD thesis. I designed an evaluation framework to identify those risks, to assess from a normative perspective how the distribution of harms and benefits um, it was being presented, and in which scenarios was justifiable to use AI, and in which scenarios we had to exercise restraint or caution before going about that implementation.
So am I correct in understanding that some of the, for example, the commercialization and the hype around AI, does that contribute to the problems that you might see within like the medical field, or is that sort of a byproduct of the problem? Like, does that actively contribute to how AI is used?
I think so. I mean, it occurs differently in different countries, depending on how those
Mm.
countries' systems are designed. So you think about the US and this system of incentives, system of premiums, and all, how the construction of the insurance systems and the
Sure.
health, it's very specific how these tools are marketed, how they are regulated, impacts on how they are being implemented. So if similarly to pharmaceuticals, if there's sufficient incentives for certain physicians to offer certain medications, the market of this medication and the regulation of this medication um, is impacted by this, and how the uptake of patients of this medication would be influenced by it. So it depends on the administration, on the specific system, but definitely the marketing and the hype around a product can influence how this product, so the ethical issue this product creates, um, because it also generates a sense of of excitement, of um, yeah, let's call it excitement that might obscure the trade-offs that we are still needing to confront, or the downsides that we also need to
Mm.
confront. On the other side, it happens the same. If we think about the um, scenarios in which AI is being portrayed as sort of this Terminator situations of the end of humanity, that also obscures the possibilities that AI might bring us. So
Mm.
there's a really interesting paper about the negativity crisis of AI ethics by Peter Koenig, and he describes it quite masterfully, that we tend to only focus on the harms and the risks, but not so much on the possibilities and the opportunities. And I think for a normative and an ethical or balanced, robust ethical assessment of anything, we need to identify and assess and weigh both the opportunities and the risks, and be um, how can they be integrated. So just concentrate on one side is problematic,
Okay.
and not just on the hype, but also on the doom.
Yeah. So we'll definitely get into your framework and sort of the various risks that you studied. But I'm interested, you mentioned that obviously machine learning systems and assistive technologies have been part of the medical field for a very long time, as you mentioned. So I'm interested, how has the field of medical ethics sort of evolved as uh, AI or modern AI was introduced? Is there something like fundamentally different in how this form of AI is deployed compared to previous tools or technologies that might be more um, benign, or they might be more harmful in some ways? Yeah, could you sort of talk about how the evolution of technology has impacted the field?
Well, that's an interesting question. It's difficult to answer because technology has been moving at such a fast pace, and I've kind of not changed my mind, but I mean, open to changing it. Mm, because AI systems are tools,
Hmm.
I do not ascribe to the idea that AI is, is somehow sentient or conscious, and I do not ascribe to the idea of giving it moral status in the classical sense. So I still think about these systems as tools, and tools can be used in productive or unproductive and risky or safe ways. And in general, healthcare is a field that is very averse to risk. So they tend to be, even in administrations that are much more, let's say, liberal, they tend to be quite strict about regulation regarding healthcare um, devices or procedures. The FDA, it's notoriously strict on their evaluations of medical devices. We can come back to that because lots of AI tools had not been registered or trialed as medical tools, and therefore they bypass these regulations. But the FDA, as it is quite strict. Also, the European Medical Association as well has
Hmm.
strict regulations about medical devices. So, so one thing is about implementing tools into the system, which is already complicated. What makes AI different? And this is a question that goes beyond medicine, that I'm sure maybe you have thought about it, maybe the audience have thought about it. Why is AI any different from other tools we had before? Why is it different from the internet? Why is it different from the printing press?
Yeah.
Or I mean, I mean, probably you have read this, but back in the day, uh, Plato said that writing would destroy memory.
Hmm.
Other people had said that the printing press or would modify or change significant capacities that we have,
Yeah.
cognitive capacities. People, when I was a teenager, that when the internet came and Google came and the um, digital printers came, my teachers in school would say, well, you're going to lose your capacity to, write by hand, and this is going to be really bad for you because, you're going to lose that
Yeah.
capacity. So now we're having the same argument now. We are asking ourselves, well, by introducing these tools, not just in healthcare, but in many other fields, we're asking if this is any different from previous tools. Also in medicine, you think about the stethoscope.
Yeah.
Before, doctors had the capacity to hear very minimal types of heartbeats or differences in the breathing of persons, so they could diagnose certain lung conditions based on just hearing, and they've progressively lost that capacity because the stethoscopes made
Mhm.
that so much easier and much accurate. So the question is, are these tools any different from other tools? And so up until 2020, T1, I was on the side of the field that said they are much more like any other tool. It's just faster, and this is not a bad thing necessarily, especially in healthcare. Now, however, after the advent of generative AI tools used for offloading of cognitive tasks and offloading of moral tasks, even, I am a bit more on the other side of the fence, thinking that, well, if we progressively offload certain cognitive capacities. Therefore, we are not enforcing in practicing those cognitive capacities. We might be at the risk of getting de-skilled in these capacities. And this is something I worked at length. I published a couple of papers about the skilling of medical professionals, or AI-induced skilling of medical professionals. Um, and this is a hypothesis because the skilling is a very difficult phenomenon to assess, to measure. But we still remain concerned that these progressive uploading and constant uploading might lead to certain phenomenon that changed how fundamentally we practice medicine, how medicine, the goals of medicine are conceived, and also how this might impact the profession of medicine. So there's different areas of development that I think we should be looking at quite closely in the next couple of years.
I see. Yeah, so we'll definitely talk about your work in descaling. And I think this whole um, trajectory sort of resonates a lot with what I've been experiencing as a student as well, especially when AI was just first coming out in my lifetime. A lot of my friends and family members were saying, oh, when the calculator came out, it's not like people stopped doing math. So but it does seem like all of a sudden it's taking a lot of abilities that are actually much more important than just doing arithmetic or just doing handwriting, and things like that. So we'll definitely get into sort of that in a little bit, but I want to backtrack a little bit to the previous topic discussion about navigating ethical risks, and sort of the framework that you set up, I think, regarding your PhD dissertation. So could you first, talk a little bit about what are the ethical risks that you think are the most important to address? And then also, of course, what was your approach to navigating and addressing these issues?
So what kind of risks do I think are the most important ones? So that's a contentious question. I don't think I can say which are the most important
Sure.
ones. I can tell you which are the ones I concentrated the most
Yeah.
in my dissertation. So I think that I'm really interested in the unintended consequences of AI. So we think about consequences in terms of privacy,
Hmm.
in terms of discrimination and bias,
Yeah.
which are incredibly important questions to ask. And there are lots of people who are doing really important work about this on these questions. I was more interested in my dissertation about the questions of how is how is how are these technologies changing who we are, who we perceive ourselves, and how they're changing the relationships we have with others, particularly relationships of normative significance.
Mhm.
And in medicine, we have lots of different, really significantly normative of relationships. We think about the relationship between patients and physicians, for starters. In the body of work in biomedical ethics and in medical ethics, this relationship it's what we call fiduciary relationships. Is conceptual. They're conceptualized as relationships of trust. So when a person goes to the medical practice and seeks assistance from a physician, they are creating a sort of or a type of special moral relationship in which the doctors are required to behave or required to make decisions taking into account the best interest of the patient. And the patient is trusting that the doctors
Mhm.
and physicians will do so. And this kind of creates a set of moral obligations, special duties from the physicians, and leaves patient in a way in a vulnerable position because they have, let's say, less knowledge. If they are in pain or they are ill, they are less, say, less um, have less ability or capacity to make certain decisions, and they trust that the physician would
Yeah.
cover that role, right? So those are relationships of moral import. We have many others, but what happens in these situations is that the introduction of AI changes a lot on how these relationships go about. So think about people who now, I mean, this was happening before AI, but now it gets exacerbated by especially generative AI tools. People asking Dr. Google a set of symptoms and getting a response.
Yeah.
And then going to the physician and saying that, but Google said this. I did my research. I'm sure everybody have heard something like that or have even
Yeah.
felt like this, that they want to be informed because for them it's very important to be able to participate in this exchange in sort of a bit more of an equal position.
Sure.
And this illustrates a big change of paradigm that has been happening since a couple decades from a medicine that is mainly paternalistic to a medicine that is more autonomy respective, more focused on the autonomy of the patient. So I don't know if you can think about 50, 100 years back, the patient did not uh, um, was not in a position to kind of tell the doctor like, yeah, I disagree with you, or I want you to tell me why is this happening. Usually the patients were, as the Latin word suggests, patients. They will wait and kind of suffer. That's the Latin root, would suffer the illness and wait until the physician would help them. Now we have a very different idea of what medicine is and how it should look like. and patients are in a much more present, active role in the medical exchange. And the addition of medical of tools like AI, like generative AI tools, makes this, capacity or access for to information to um to different resources that that, that brings an interesting question.
Mm,
Is it a good thing to democratize the medical knowledge so people are in a better position to take charge of their own health,
mm,
of make more informed decisions? Does it have a connection with informed consent? That in the medical
yeah,
cases is very important, or might be disrupting the kind of relationship that physicians and patients have, because then physicians maybe do not trust the
sure.
physicians anymore to act on on their best interest. And there are also questions about, well, if physicians use certain models to expedite certain diagnosis, to take notes, to record patient conversations, well, aside from the questions of privacy
Yeah,
and management on third party data, um, is the physician actually using the AI tools to free time so they can spend more time with patients, or are they doing this and they just will have a higher workload? So there's lots of interesting questions about how AI tools impact those relationships, and that's specifically the risks I wanted to explore in my thesis, these interpersonal relational
mm,
concerns that are not as research as other risks such as privacy and fairness and
sure.
discrimination, and then that are much less, or like much more difficult to conceptualize and to assess. So that's kind of what I was concentrating on my PhD, was more of a making a relational assessment of those normative salient um, considerations that emerge in those relationships. And I also, for this purpose, I applied a rights-based approach, from the philosophy of the political philosophy, especially from the work of my supervisor Klaus Steigleder in Bochum, who draws from the work of like Kantian philosophy, and others.
Yeah, very interesting. I think, uh, well, I have a couple of follow-up questions. So obviously, you mentioned that there's a variety of outcomes that can occur from this introduction of technology. We can either have um, more informed patients, or we can have more skeptical patients. So, what's obviously there's no real answer to understanding whether which bucket we may fall into in the future. But what sort of questions would you ask in order to understand which direction we're maybe following, starting to follow? What sort of questions should we ask of these systems to understand what will be their end impact?
Um, so we need to ask questions in several directions. So a direction is, or we can distinguish them in depending on, or we can do this depending on in which step of the pipeline we are located in.
Sure.
So if we think about, what I mean by the pipeline is the pipeline of a development of a machine learning system or AI system. And the pipeline starts from the moment of ideation of a tool. So the moment where the designers, the developers sit down and think about, oh, we have this problem, we want to develop a tool or a model to solve this problem or to address this problem. The end of the pipeline will be um, the point at which the tool is already implemented into a concrete context, and it's been supervised, or um, yeah, it is being used and constantly evaluated.
Hmm.
So you have this pipeline, and it's not a linear pipeline. Of course, it's probably like cyclical at some point. But let's, for the sake of the argument, just think about the pipeline as a line. Um, and in each, there's like different questions that need to be asked at different points of that pipeline. So at the beginning of the pipeline, when the problem is being conceptualized, one of the problems that we are facing and that we have been fixing, I think some really good work is being done about this, is who is sitting at the table. So usually before, the only people sitting at the table were the stakeholders of the AI companies. So the designers, developers, the um, investors, the management, and everybody who is interested in how this product works as a product. Progressively, there have been more people are now sitting at the table, like healthcare professionals who know exactly how the problem looks like and how the challenges of implementation would be like. But also progressively, there are initiatives to include patients in these conversations and how the patients want these tools to be developed. What concerns do they have about the development of the tool? And how those, the work is integrating those opinions, those views, and treating them as design principles or as guiding principles, or there's different alignment strategies, there are different methodologies about this process. Um, there's the point of development of the pipeline where all these technical questions arise. So we need to ask also technical questions about, can we explain the models? Is it explainability meaningful at all? For certain purposes, sometimes it's not, but sometimes it is very important. Regulation also has lots of questions to ask about safety, about how to safeguard patient data. That's extremely important. Um, how to make sure that this ethical principles about what kind of data gets shared with whom, how to de-anonymize data. So in case a leak happens, this does not affect the patient's integrity. So there's lots of interesting ethical questions that need to be asked as well. Then there's at the point of implementation, or at the point of deployment before implementations, how this goes from being a model in a lab or in a controlled environment to an environment that is variable, that is dynamic, that is already I know full with other types of tools. So how this integration in these environments, in these contexts, is going to look like. What type of literacy strategies are we going to implement for the physicians to understand the implications, not just technical, but also societal, also organizational? How is it going to look like? How is it going to be about preparing for unintended consequences or unintended situations, such as a hack? So if a hospital is hacked, how are we going to respond to that? How are we going to protect patients' data? How are we going to protect the workflow? How are we going to, if we cannot use the systems, what alternatives do we have that analog? And this happens much more than we think. DOS attacks, or in general some hacks,
Yeah.
happening all the time. We just don't hear about all of them all the time. So this is questions we need to ask about the system robustness in specific contexts, that also organizational questions, institutional questions, regulatory questions. And then at the end of the pipeline, when the model is being implemented, how is the patient being benefited by it? See, from the beginning, this is a question that goes back, again, this is not
Yeah.
linear, it's cyclical. Goes back to the beginning, is what type of problem do we have that requires AI as a solution or part of the solution? Not all problems in healthcare are susceptible to be fixed with that AI fix. And in some cases, AI can be very beneficial, but sometimes it's not.
Mm-hmm.
And we need to be prepared to evaluate that and decide whether or not it's worth to use certain tools, whether or not this is providing a benefit to somebody along the process. Is it maybe providing some sort of benefit to the physicians, maybe to the organizational, so the system as a whole at the hospital, the praxis? Is it benefiting the patients, and are we assessing patient outcomes, how the patient outcomes have changed, have been improved or not by the usage of the tools? Sometimes it's very, and going back to one of the first questions about the hype, sometimes the hype might lead us to spend all of these resources in developing, implementing, and using the systems, and at the end we don't see no big difference in patient outcomes. So it's worth asking whether needs to continue, should stop.
Mm.
It should be a dynamic process.
Sure.
So yeah, so there's all these different questions of, let's say, like ethical nature, but that of different, so let's say, of ethical significance, but different nature. So technical nature, implementation nature, regulatory nature, but that have ethical significance along the way. And this is something that we cannot look as just notes of questions. We need to look at it from an integrative perspective, because all these questions play a role along the way. So it also can be that they aggregate issues. So if we have, when we do not ask the right questions at the beginning, we will have issues at the end or
Mm.
in the middle. So it's worthwhile to think very carefully what problems we need to solve in each step, that we do it judiciously to avoid especially having concerns or challenges or issues at the end when the system is being used.
Mm.
And to prevent that, ethics is a great tool. So
Mm.
ethics or ethical inquiry is not just about pointing out the obvious. I think that one of the most interesting aspects of ethical work and philosophical work in general is the prospective nature of ethics. Ethics can look ahead and tell you, yeah, we see those unintended consequences. We have a vast body of literature about how have been doing this in the past in other fields that we can borrow from. And we don't need to wait until something harmful happens. We can anticipate. And this is something what we keep trying to do. And sometimes it's not so easy to convince some key stakeholders about it. But I think it's really important to understand that ethical work is not a stopper or a obstacle to innovation.
Mm.
It's not an obstacle to advancement in different fields. It's actually a tool for sustainability. If we do things ethically from the beginning, if we do it smart from a philosophical perspective, we probably would avoid lots of issues along the way that would affect the viability of a product or the sustainability of an initiative. So that's just one of the things also connected to some of the questions you've asked. I think ethics has an impressive capacity to look ahead and to connect interdisciplinarily with different in different contexts to inform how should certain courses of action be guided. And that's why I think for these kind of questions of integration of AI in healthcare, but also in education, which is what I'm doing right now, this is a fantastic, very useful way of studying this problem and contributing to them.
Yeah. Yeah. Very well put. I think, again, it also sort of reminds me of how science is often used. A lot of scientists use past experimentation to predict future outcomes. And in the same sense, that's exactly what this work is about. So I think you briefly mentioned also um, in that about the risks and the opportunities that an introduction of a tool always poses. And I think that's a concept that you also previously alluded to. So maybe we can talk a little bit more about that. So how should we evaluate whether a tool is uh, on net worth using, and then also who gets to decide whether this tool is worth using?
So I don't have a clean answer to the first question. And this is ongoing work in different fields. For instance, risk ethics
Hmm.
or different types of risk assessment is how do we balance the potential or realistic risks with potential realistic benefits.
Hmm.
I mean, it's very contextual. If you think about, I give you a concrete example. Um, I don't quite remember the name of the tool, but there was a AI-driven assess diagnostic tool for diabetic retinopathy in the US. Maybe you're familiar with it, but I think it was installed in all sorts of different sites like Walmart, like this kind of like non-medical settings. And really any person with a school degree could be trained to operate this tool. and the accuracy level of this tool to diagnose whether or not you had some sort of issue of diabetic retinopathy, which is um, a problem like that affects a lot of people. Is it's a huge problem that leads people to losing their sight, and then this affects terribly their capacity, their well-being, and capacity to live a healthy life. So the risk of this tool is really low. So it requires no sort um, of risky intervention. There is nothing about putting any type of liquid in the eye. So it requires nobody to. So it doesn't require somebody to be accompanied by somebody else. So you could just pack your car, pop by, get this thing in 10 minutes, and go home, and you will get a really accurate, not 100% accurate, because AI tools are never 100% accurate. At least as of now, there's not 100% accuracy, but really high accuracy, like over 80%, I think. And you would get test results. And if the the model detected you might have a risk of suffering from of detecting some sort of diabetic retinopathy, even very small, it would tell you need to go to the doctor, so you can get properly checked, get like much more accurate assessment done. So in that case, when you think about the net benefit, if you think about, well, the benefit is pretty high because the accuracy is pretty high, the risk is pretty low, anybody can be um, trained to operate the system. It takes very little time and it's financially very viable. Then, of course, this is a kind of a clear-cut question. Sure, we should be doing this, no questions asked. But this is needs to be assessed in concrete cases. So, net assessment of benefit has to it needs to be a process that evaluates concrete scenarios and assess concrete scenarios. So it's very difficult to say, do a blanket assessment, or yes, you should fulfill those criteria. I
Hmm.
think it's very difficult to do. I mean, we can come up with certain guidelines of,
Hmm.
well, if it's below X accuracy,
Yeah.
it's not worth it, or if it's the cost is over X amount of money, then it's not viable, or if requires a huge infrastructure for people to access it in countries where, or in areas where there's no access, then of course it's just not worth it because people won't be going and using it.
Yeah.
So I think it depends on those concrete questions. Oh, now what about your second question? Who should be sitting at the table?
Yeah.
So this is a bit less of a specific or like casuistic requires a casuistic kind of answer. Definitely the people who are um, gonna be using the tool or gonna be at least passively affected by the tool. And this is very difficult. In healthcare, it's a bit easier because we can think about, well, physicians or patients being kind of the main stakeholders that count as users, while in the middle ground we have hospital administrators, we have ethical boards, we have patient associations, we have insurances, or insurance companies. So we have all these different actors that have sort of an interest or certain sets of interests in the question of how these tools are
Yeah.
implemented, in which way they are going to be financed. So definitely certain voices need to be highlighted. I think that the people who are going to bear the brunt of the potential harms or risks should be taken into consideration. Um, not, I think, or take some preeminence over others that might have just say instrumental
Yeah.
interests, so related only to the finances or only to the operational aspects. But definitely, there needs to be much more participative alignment strategies that gather the voices of people who are affected by those tools for sure.
Yeah, I mean, I wanna spend a lot more time on this, but just in the interest in time, I think we can move on a little bit to, some other topics. So, one of the last topics I wanna talk about is the concept of de-skilling, which I think you, previously alluded to. So, could you just briefly outline what is de-skilling? How does it occur in the medical field? And then how do you envision the future of medicine, I guess, addressing and navigating these issues?
Just to be fair, I am hopeful about the future of medicine. Just to start with that. That being said, I think that we have a sea of opportunities to pursue, but also we need to be critical about it. And this is along with the perspective quality of ethics. The next aspect of ethical and philosophical work that is quite important is our capacity to be critical and engaging critically
Yeah.
with these scenarios and these questions. So the skilling is, let's call it a phenomenon
Hmm.
in by which a person or a profession progressively loses or set of skills in a profession are eroded by change. It can be any type of change. And I mentioned this is a phenomenon. It is not quite true. The phenomenon is called skill shift. So skill shift is something that has been happening since the beginning of time, since we became users of tools.
Yeah.
And progressively, we have lost the ability of doing certain things in trade-off for the ability to do other things that adapt better to our present circumstances, to the new advancements we come up with. So, in general, it has to be said that skill shift is not a negative phenomenon. It's just a phenomenon that we have been experiencing for as long as we have been as long as we have been innovating. So that being said, the skilling in medicine is a phenomenon that comes along with not just losing or erosion of skills, but also with the uptake of new skills or the refinement of certain skills. So we have the skilling, upskilling, and reskilling as
Hmm.
three kind of aspects of the phenomenon of skill shift.
Sure.
The, and this goes back kind of connected to the question that you made before about what makes AI different.
Yeah.
Can we say it is different? Connected closely to it is it or the one of the questions I am really interested in is how is AI changing the development of skills in medicine? And can we say that is it posing a risk to those skills in now in a negative sense? Is it this skilling happening too fast, too quickly for us to catch up with the reskilling and the upskilling? That's more accurately the question. And as I argue in my papers, well, it's not super easy to say that this is happening at a pace that we cannot not keep up with. What we can say is that there are certain skills that are more prone to be eroded, and with the advent of generative AI tools, we're seeing that certain abilities have been like progressively are progressively less strong in certain junior physicians, in even medical students. And maybe that's the interest or the interesting part of this phenomenon is not just what's happening to the physicians now. So whether the physician who is a practicing physician today in 20 years, what is going to be the state of certain skills is more what is happening to the medical student now, to the junior resident now who's starting their careers, and they need to develop those skills. So of course there will be a set of skills that is arising regarding how to use those tools, how
Yeah.
to evaluate the tools, how to evaluate the outputs of the tools, and there's lots of critical thinking that needs to happen there as well. It's not that we are suddenly losing all critical skills because of AI, but there are, I think, more interesting and more nuanced problems there. One of them is usually how the structure of medical training works is somebody starts as a junior resident and they get as an intern, sorry, and they are assigned to a senior physician. um I think they're called residents and attendings, and this certain hierarchy in terms of experience. So people who have been there much longer have had the opportunity to develop skills, to hone those skills through repetition, through study, through um, being accompanied by senior professionals. So this kind of partnership, which again goes back to, those relationships I was talking about that I'm interested in as unintended consequences in a relational perspective. So if those seniors um, or the senior level or mid-level of seniority starts to disappear because they don't need the skills anymore, or they progressively lose them to the same degree. So the junior interns or the medical students won't have the same opportunities to learn from their seniors as previous generations did. They won't create the same type of relationships of apprenticeship or mentorship that they were before, which, in my opinion, would erode the fabric of the profession of medicine,
Mm.
because medicine relies a lot on these relationships, on these pass along the knowledge and the experience, not just by studying but by doing, by observing. And this observance, this practice can only happen if we are in those scenarios day by day. So and this is not to obscure that a lot of the healthcare systems have lots of holes, lots of problems, lots of systemic inequalities and I mean unfair issues with fairness, and that in the systems not all um, interns and medical students have access to good seniors that have access to resources to learn in this kind of ideal way that I am describing. In which case AI tools could be perfectly acceptable replacements or supplements to their training, to their knowledge. So the problem there is, how do we anticipate so so how to anticipate the pattern of skill shift that is now it's becoming really hard to do, because as the technologies progress and as companies get really excited about possibilities in healthcare, and medical practices get really excited about saving money, and making processes more efficient, which is fair because lots of processes in medicine are very bureaucratic and very frustrating for everybody. It is very difficult to assess this path of skill shift. And aside from anticipating the path of skill shift, is how are we preparing ourselves, and how are we preparing the profession to reskill and upskill at the
Mm.
appropriate moments? So as I say, I don't mean to say that we should stop using AI, that AI is a or forecast something like a negative future for medicine, not at all. But I think that there's a lot of uncritically adoption of AI in many areas of medicine that i- is not really looking at what is the net benefit, or what is the how whether these promises of benefit could be actually be realized in those contexts. I think there's a lot of or there's like lack of conversation happening about which problems need AI solutions and which problem need systemic solutions that might or might not be include AI. I think there's a lot of mm, yeah, lots of lots of conversations also not happening regarding um, how this is going to be financially feasible. So there's a lot of concerns about um, which insurance companies are going to cover what, who is going to be funding which aspects of of the implementation. Um, it's also less clear how are we training our future physicians, and what skills are we thinking they're going to need for certain systems. It's also unclear, the question about fairness, how in the case of implementation in certain contexts, who is going to have access to it and who is not. And I mean, we think about problems of inequality around the world. In European global north countries, as they call them, the access of to healthcare and resources is very high, but we go to another parts of the world, they don't. And would AI be a solution there for those situations where there's no infrastructure or there's less infrastructure? So there's, lots of questions about connected with the skilling problem is, so we have a set of skills. That set of skills will change regardless of AI or not, because as we advance, we're going to have different tools. The most interesting question is, I think we should spend some time developing methodologies to understand how this skill shift is occurring so we can prepare for it, so we can um, develop a research, kind of what I did in one of my papers, a research agenda of what kind of skills we're prepared to let go, but what skills are fundamental to the practice of medicine and why. And in the future, in different contexts, and this needs to be contextually, culturally informed, which skills and which implementation need to be hand in hand to supply or solve the issues of this particular context that might look very differently. We look at countries in Southeast Asia, or we look at countries in Central Africa, or we look at countries in Latin America, as opposed to countries in Western Europe or in the north of of America. So I think this again, it's like the questions of skill shift and the skilling had to do a lot with questions about how do we envision the future of medicine to look like, and how can we prepare for that future. And again, this perspective look is something that we need to be asking. Yeah.
Yeah. And obviously, you mentioned that you were relatively optimistic about this future. And that's not to say that I am not or anything, but I was just wondering why you think that you are particularly hopeful about the future of the medical profession. Like, what sort of informs that about you?
Well, I think that as far as I I've been seeing in the field, so there are a really good number of people being critical about it, so
Mm,
being cautiously optimistic.
sure.
That has been balanced the hype. So I think um, 5 years ago the hype was really strong,
Yeah.
and it was everywhere. Now the hype, not it has, you can say, has died down a bit, in the sense that it has been tempered by reality and by um, people doing the work of um, understanding and thinking about how to turn these tools into problem solvers instead of just glorified talking systems that do look nice. It can be marketed really nicely, but not too much. So I think there is a lot of interesting work, lots of evidence about the potential of AI, but not just the potential anymore, but the results that it's giving us. So there's lots of area of implementation that has given us results about reasonable, interesting, productive implementations of AI. And there's a lot of work about what the mistakes that we have been making, or the challenges that we have, and how to address them in a responsible way. So I think, I mean, in general, medicine is one of these fields in which we think that, or people in the field really want this to work well, because we are dealing with patients and patients' lives. And at the end, we're all potentially patients. So we all want a system that works for all of us, or systems that work for the good of the community. So I think I'm hopeful, because research has been done well in many areas. Of course, there's challenges, there are failures there, but that's part of the advances of science as well. And I think that institutions and governmental structures have been trying really hard to keep up with the need of providing strong infrastructure. So of course, again, it's not perfect, and I'm not saying we're living in an utopia where everything is working well, not at all. But I think that I'm much more confident in our capacity to turn these um, these potentialities into actually
Sure.
productive implementations,
Definitely.
much more than I was 5 years ago.
Sure.
So yeah, cautiously optimistic, but I think I feel much more confident. Yeah, that's
Sounds good.
that's my we can discuss again in 5 years and see how the field has developed. But
Yeah, good
as of
idea.
now,
Good idea. So before we wrap up, I just wanted to briefly talk about one last thing. So I understand you also contribute to a project called the Children's Agency in the Age of AI. It's something along those lines. So could you briefly explain what this project is and also what your role has been?
so this is actually my main work right now. So
I see.
as I mentioned, I am not working so much in healthcare anymore, although I'm trying to keep up. I'm doing some work in skilling as well in AI in mental health. So kind of connected what I'm doing right now. So just to answer your question, so Child, the project I'm working on right now, is a UK research and innovation funded project in the UK. I'm working on the University of Oxford. This is where the Institute for Ethics and AI is located. And what we're interested in doing, we are a group of philosophers, computer scientists, and educational scientists. We are interested in understanding how generative AI is shaping or restricting or even facilitating the exercise of agency in children. So agency is a difficult concept to define, notoriously complicated, but we define it generally as the capacity or the capability of children to enact or effectively enact decisions to pursue courses of action. And in the environments in which, so the situation we have right now, that in which AI tools are being used by children from a really young age, we have not really, or society has not really um, come up with a way to understand how the introduction of these tools in young children's lives is shaping their, or might be shaping their capacity to exercise agency. So from a general perspective, agency has to do with intentional action, has to do with the capacity to plan, to formulate goals, to carry out actions that correspond and bring about those goals. And different disciplines have explored the concept of agency in children, more prominently psychology, cognitive science, and sociology of childhood. However, from philosophy, there's really interestingly, children have not been the focus of discussions about agency. So agency is usually conceptualized in terms of adults. And an interesting part of it is because children are considered to be incomplete agents or have undeveloped capacity for agency because they do not have, what in philosophy is conceptualized as full rationality and autonomy, as the capacity for self-legislation, from this Kantian perspective.
Mm,
So um, we have this perception, okay, the children are not really agents or incomplete agents, but then we have that they are in any way making decisions about the uses of these tools. They are using it for learning, for doing homework, for researching topics. They are using it for leisure, for entertainment. They're using it for companionship, for advice on sexual health, mental health. And all these uses and the environments in which they use these tools, it's pose really important questions about regulation. Should these tools be banned, restricted? I don't know if you heard, maybe not. The UK Prime Minister yesterday informed, or they informed the nation that they passed a bill to ban social media for children under 16 years old, similar to the model in Australia, starting from next year in spring. And of course, this brings lots of interesting questions about whether that's a good idea, whether that's a solid idea, whether that's an ethical thing to do, which right now we're addressing in our project. So the project or is divided in different sections. What I'm doing right now is contributing the conceptual philosophical
Sure.
work to define or to conceptualize how children's agency look like, what does it mean, what requirements does it have, how is it different from adults, can children be agents? I argue yes, children are agents. Like I'm rejecting a bit the opinions of Kant and Aristotle about this. And from there, we want to, or what we're doing as well with the computer science folks is to, or we intend to create or to develop a set of design principles through co-design studies and different empirical studies with children to answer the question, can AI support children's agency? And if yes, what kind of design principles do we need for it? So that's basically what Child is doing at the moment. It's a really interesting project. I have amazing colleagues and mentors at the project. So it's been really fun also connecting with a different kind of group um,
Yeah.
of,
Yeah. Yeah.
of questions about implications of AI in a specific field. I'm still very passionate about bioethics, and maybe I will go back full time about in the future. Mental health is also a really
Mhm.
interesting question about how AI for youth is affecting or is impacting questions about mental health and how they're going about using AI for as AI companions, as forming certain type of relationships with the tools. And yeah, so in that sense, it's really interesting work as well.
Yeah. Very, very cool. So, I won't take any more of your time. I think we can wrap up the episode here. I apologize we weren't able to discuss your more current work in greater depth, but I hope you found the session nonetheless interesting and engaging. So thank you, Doctor, for your time. I definitely enjoyed this, and I'm sure our audience did as well.
Thank you so much for your time as well, for the invitation, and I hope your audience also found this discussion interesting. And if anybody in the audience or you guys at the Lexicon would like to have discussions as well or connect and different, I think I'm in LinkedIn or my email. That's always a really nice way to connect. So thank you so much.